I'd like to welcome you, Richard Parkinson, who's the director of Farrpoint, and he's going to talk about the digital shift, but particularly focusing on a piece of work they've done for what was NHSX, but is now, is it the Transformation Directorate, I think is the right term, and as well as a more forward-looking perspective on what is likely to be quite a catalyst for change in the technology-enabled care sector. So I'll hand over to Richard now.
Thank you very much. Morning. Hopefully there's someone ready to drive my slides for me on screen. Thanks for inviting me along today. Maybe worth me just starting by explaining who I am, because some of you probably haven't heard of Farrpoint before. If you could just go on to the next slide, please. There we are. And I promise this is as close as I'll get to a sales pitch today. Farrpoint is a technology consultancy, and we work across a range of digital projects, predominantly with the public sector. And as part of that work, we've been involved in technology-enabled care and telecare for about the last 7 years. And that work is focused in kind of two main areas. One is around developing tech strategy, so helping organizations understand how technology can improve care services and how they're delivered. And the other part is around providing implementation support. So that generally means kind of working alongside organizations, acting as kind of a technical friend as they go through the process of implementing technology in their care services. And we bring to that kind of some of the wider experience we have of delivering digital services in the public sector. As part of the work we do, we work for a range of organisations. We work for UK government, and that's some of the work that we'll be explaining and discussing today. Also work with the national programmes for telecare and tech in Scotland and Wales, as well as working for some telecare providers themselves, the councils and housing associations, etc. So that's who we are, and kind of why we have an interest in telecare and tech. Next slide, please. Kate asked me to just give an overview at the start, just around the digital shift. I'm sure a number of you are aware, but there could be some people that aren't aware of what it is. So just a couple of slides, just explaining again what the digital shift is, and just putting some of the discussion today into a bit of context. Next slide, please. What the digital shift, when we're talking about the digital shift, what we're talking about is the process that's happening at the moment, where all of the phone lines in the UK, so all of the phone lines into everybody's house and all of the businesses, etc., are being moved from analog technology to digital. This process is happening now. It started a couple of years ago. It's in progress, and it's due to be completed by the end of 2025. So a little over two years away. There's about 600 phone providers, believe it or not, in the UK, and each one of those has their own process and timescales and plans for completing this shift, which means basically that individuals and businesses could be moved across from analog to digital technology phone lines at any point. What this means in practice, I tried to give a couple of examples here in the diagrams on the right. The setup, excuse me, that people have at the moment is shown in the top diagram there. And what this is, I mean, you'll be familiar with this, is that the phone, and if you have a Telecare alarm in your home, that will usually be plugged into a BT box on the wall. That is connected to an analog phone line. So if you make a phone call, or if a Telecare alarm triggers, that call is carried across a voice network as analog voice, as a voice wave. In the case of a Telecare alarm, that call will arrive at an ARC. I used the phrase ARC a few times in these slides. So that's Alarm Receiving Center, where that call is answered. When that home is moved across to a digital phone line, what you'll be asked to do is to move your phone and your Telecare alarm, unplug it from the box in the wall and plug it into a socket on the back of your broadband router, usually on the back of your broadband router. What that broadband router is doing is completing a conversion. So it's taking the analog waves that your voice is, and it's converting it into digital, so it can be sent across a data network. So what that means is when your Telecare alarm makes a call, it's converted to digital in the broadband router, carried across a data network. When it arrives at the alarm receiving center, it's then converted back from digital into analog, and so it can go into the alarm receiving center systems. So that conversion process is quite important, and I'll come back to that on the next slide. So next slide, please. So why does all of this matter? It matters because Telecare equipment that's out in 1.8 million homes at the moment is almost entirely analog. And it uses something called DTMF to signal. So the signals between the alarm in the home and the alarm receiving center use DTMF. DTMF is dual tone multi-frequency. It sounds complex, but you'll be familiar with this. This is the tones that you hear. If you pick up your phone and press the keypad, the tones that you hear and that you sometimes use when you're asked to select an option, if you phone up, your bank, etc., and type in your card number, it's those tones. That's DTMF. So the alarms use that technology to signal. It's a 1960s technology. It really has been around for that long. And because it's such an old technology, the digital phone lines and the digital networks that are being deployed at the moment really aren't particularly well suited to supporting that kind of old technology. And what that means is that in some cases, because it's not designed to support it, that signals can get corrupted. So the signals from the alarm and arriving in the alarm receiving center can get corrupted. And that means that in some cases that calls made by the Telecare alarms don't connect correctly. The example on the right, it's maybe a bit Janet and John, but I think it kind of illustrates this. So what you can see on the left there is a Telecare alarm making a call. It's saying, hello, I'm alarm ABC 123, and the triggered is the smoke alarm. So that's what's sent by the alarm. And then there's potential for that signal to get corrupted. So what actually arrives at the alarm receiving center is maybe missing some of that information. Maybe the alarm ID isn't quite all there, or the trigger, what's triggered it, isn't quite there. And what that means in reality is that the alarm receiving center will say, I don't know who this is, I don't know what this is, and it will drop the call. And the alarm in someone's home will have to phone back again in order to try and connect on a second attempt. So that we refer to those as failed calls. The level of failed calls that people are seeing or expect to see does vary. It varies depending on who the phone supplier is that is using the home, the type of alarm, the type of alarm receiving center. There's a number of factors that can affect the failure rate. The answer to all of this, how to address the problem, is what the industry is undertaking at the moment. And that involves moving all of the equipment in people's homes, replacing it, and all of the equipment in the alarm receiving centers, and replacing it with equipment that natively supports digital. So it doesn't use DTMF, and it doesn't have this problem with the conversion. So the problem of failed calls goes away. So that's the process that everybody's undertaking at the moment. I'll stop there in terms of the background. Hopefully that's a useful kind of overview of why we're all getting excited about the digital shift. Next slide, please. So I'll move from that and talk about the study that we've done for what was at the time NHSX, now variously known as the NHS Transformation Directorate, and also as part of Department for Health and Social Care. But I'll use NHSX because it's easier to say. So this is a study that we did at the tail end of last year into the digital shift and its impact on the telecare sector. You go to the next slide, please. The study that we did covered kind of four main questions, four main areas. One was we were asked to establish the level of awareness within the sector about the shift and its impact on, just go back for one, thank you. The level of concern that the sector had about the shift. The levels of readiness and planning to address the shift, the opportunities and challenges that people saw associated with the shift, and also to try and identify if there's any additional support and guidance that could be provided to the sector to help them through the process of making this shift. So the slides I've got today, I've got some of the headline findings from each of those four areas. As I said, the report that we did, we actually collected the data for this at the end of last year. The report itself is due to be released in the next few weeks, and it's going to be released alongside an action plan, which NHSX has developed to address some of the recommendations of the report. Next slide, please. The information that we are presenting, we gathered through a range of online surveys and stakeholder interviews. We received about 50 survey responses, and we completed about 30 in-depth interviews, and that was across a range of stakeholders involved in the sector, from telecare providers, telecare service users, and on the supply side as well, from organizations that provide equipment and services as well. So moving on to the next slide, and the initial kind of area that we looked at was around awareness. So we asked the organizations, how aware they were of the digital shift and the impact that it will have on telecare services. And the answer is there's high levels of awareness out there. So the two graphs here, we ask questions. The graph on the left is of telecare service providers. So it's typically housing associations, councils, and the like. So these are people that either deliver or commission telecare services. And you can see there that 74% of them said that they were fully aware of what was happening. The graph on the right is on the supply side. So these are organizations that either sell telecare equipment or telecare services, so call answering services and things like that, and even higher levels of awareness there, as you'd expect. 88% of them said that they were fully aware of the shift. So very high levels of awareness and consistent levels of awareness between providers and the supply side as well. Next slide, please. So we see a different picture when we asked, you're aware of it, what is your level of confidence about it, and the impact that it's going to have on your service. 82% of the suppliers we spoke to said they were very confident about the change. None of the providers we spoke to said that. As you can see there, there's much more of a spread of views between from the providers, and less positive. Although 44% of them did say that they were confident, you can see on the other side there's actually an identical amount. 44% said they were either concerned or very concerned. So very much more a spread of views from providers about the shift. Next slide, please. So we asked them, what are the main reasons for that level of kind of confidence or concern? When we asked people, so these are some of the themes that came out of that. When we asked them about confidence, people said they were confident because they already had a plan in place. They knew what they needed to do, and in some cases were in the process of completing the work. But also that there is a sizable number of providers, nearly 60% of them, really saw the positives in terms of this providing an opportunity for them to transform their service, and that transformation it's potentially in a number of different areas. People often talked about using it as an opportunity to change the nature of the service offering, to make it more personalized, more proactive, and move to preventative services. They saw it as a way of improving efficiency of how they deliver existing services. And integration came up quite a bit as well. People saw it as an opportunity to have more integrated services. Integration with health was obviously the top area that got mentioned, but housing, integration with housing partners and internal and external housing partners also got mentioned quite a bit as well. When we asked about concerns, won't be surprised that money came up quite a lot. There's obviously a lot of equipment to be replaced, and people are concerned on how they're going to find the budget to do that, what impact that's going to have on budgets or on charging. They're also concerned about the amount of resource that's required to complete the shift and the technical skills associated with that work. And just the lack of time. 2025 isn't too far away, 26 months away. So there's not a huge amount of time to swap out 1.8 million alarms. Lack of good practice was mentioned quite a lot. Certainly at the time we completed the survey, there hadn't been too many organizations that had completed the process. So there's not a lot of good practice there that people can learn from and share. Mixed messages and in some cases conflicting messages from suppliers came up quite a lot. And this is around things like messaging around which of their existing equipment will work if a phone line is converted to digital, and which may not work, and what the level of reliability may look like, and also around kind of how best to complete the move across to digital. And the final point, and by no means least, is around the difficulty sourcing equipment, because of some of the challenges around semiconductor shortages, not confined to Telecare, industry-wide. We are regularly seeing organisations getting quoted 10-month lead times for equipment. So clearly that's not helping when we've only got 24 months to complete the shift as well. So I think that's a summary of what we're seeing from service providers and from the supply side of the industry. If you go to the next slide, please. And as I said before, awareness amongst those people is relatively high. The awareness, sorry, just back one. Let me jump to slide there. Thank you. Awareness amongst service users is much lower. So this is awareness of the digital shift itself. A lot of people just have not heard the fact that there's a digital shift of phone lines going on in the UK, and also lack of awareness about what that means for Telecare services. So that's much lower amongst service users. The telecom companies do mention impact. You know, when they send a letter out to say you're being converted across to a digital phone line, they are mentioning Telecare services and the potential impact. But generally, what they say is you need to call your Telecare provider. And what we're finding is that the Telecare providers themselves, again, certainly at the time we did the survey, weren't providing a huge amount of information out to service users. So there wasn't a great deal of knowledge and understanding of what's happening. There has been some recent media coverage about this. I don't know, people saw Rip Off Britain talking about this, and there was quite a bit of coverage last year on the back of Storm Arwen, and the fact that a lot of people found phone lines being cut off for days at time in some cases as a result of the storms. So the media coverage does mean that levels of public awareness are likely to start to be rising, but also just given the negative nature of those stories, I mean, understandably, there's going to be levels of concern arising around this as well. So there is a need to get more messaging out about what the sector is doing to address this change. Go on to the next slide. We did ask providers and suppliers whether service users were being impacted right now as a result of this change? Is there already issues happening with services? And as you can see from the graphs there, around half of both providers and suppliers are telling us that they've already experienced issues around the reliability of their services as a result of the digital shift. And this manifests itself in a couple of ways. First way is around the reliability issues. Maybe alarms are taking 2 or 3 attempts in order to connect to an alarm receiving center, meaning a delay to service users if they're trying to ask for help. Or in some cases, alarms are not working altogether. They just will not work on a digital phone line. The other issue that we hear quite a lot is just about alarms being disconnected. If an engineer comes to people's homes to upgrade them to a digital phone line, they install the router and maybe plug the phone in and test that the phone works, great. But in some cases, we've heard that maybe the Telecare alarm hasn't been plugged into the back of the router, or in some cases it's still plugged into the BT box on the wall, which is no longer working. So it's these kinds of issues that we hear from providers, and as I say, affecting about half of them are saying that they've seen an effect to date. Next slide, please. In terms of where organizations are in their readiness and planning for actually making the move across to digital telecare to address these issues, we found that planning is generally a relatively early stage. We asked separately about what their level of planning was for the alarms in people's homes and for upgrades of the alarm receiving centers, and that was because the process that you need to take and some of the challenges around it for those kind of 2 distinct areas of the solution are quite different. The main challenge with the in-home alarms is there's a lot of them, so it's more of a logistics challenge. And what we can see is at the time we asked the questions, around 3/4 of organizations said that they were in the process of planning the rollout of digital alarm devices. Around 23% of them were actually in the process of they got past the planning and were starting to put these alarms into people's homes. But at the time we asked the question, nobody had actually completed the rollout of all of digital into all of their service users' homes. On the alarm receiving center side, the picture was slightly better, more progressed. And this is probably largely because there's fewer of them. There's still a lot. I think the TSA estimates around 170 of them in the UK. So there's still a lot, but it's not 1.8 million. And also, I think because the fact that a lot of these are provided by commercial companies, so they've got a bit more of a commercial incentive, I guess, to be able to offer a digital service to keep themselves competitive. So as you can see from the graph here, things are more progressed with those alarm receiving centers. 43% of them have said that they were in the process of implementing a digital alarm receiving center. So this maybe meant that they bought a system or a service and were in the process of making the kind of the wider IT changes needed to actually start using it, but hadn't completed those yet. And just under 30% of the organizations said that they had already completed that upgrade. So we're in the position of being able to receive digital calls from digital alarm devices already. So the final area, next slide, please. Final area we looked at was, given that's a position with people's planning, what can we do? What additional support and guidance can be provided to the sector to help them make the shift? We came up with a range of recommendations that fell into 4 main themes. First one was around better coordination. So this is coordination between the telecare sector, both telecare providers and the suppliers, between the phone providers and other stakeholders such as user groups and Ofcom. And this is really coordination to help come up with joint plans around how the rollout should be completed in a way to minimize risk to telecare service users, how better to identify people that are using telecare services and put appropriate kind of upgrade plans in place for them, and making sure that alarms are tested and working once these people have been upgraded to digital phone lines. Better communication, and again between the same groups. All of these, the sectors are talking to their own language in some cases. So it's about having more messaging going out to the public and telecare users, but more consistent messaging as well, consistent messages and consistent language, so that there's a lot clearer kind of understanding of what's happening. Business case and strategy, developing some template documents to help telecare providers plan what they need to do, and pulling together business cases to help them justify budgets, etc., for making the shift across to digital, and also strategy around transformation once you've got the technology, how to make best use of it. So providing more advice around that. And the final area was around best practice and guidance. So providing kind of unbiased guidance to organizations on things like failed calls and what equipment works and what doesn't, across a range of different technology topics, but also about some of the kind of the wider operational and service impacts of digital telecare, which we'll be talking about a bit later. As I said at the start, all of these kind of recommendations around support and guidance have been pulled together into an action plan by NHSX, which is going to be released in the next few weeks alongside our report. And I shall stop there. Thank you.